Hello, good evening, class. My name is Chanel Wingfield, and I decided to do my disease project on RSV. So, I want to start by telling you guys why I chose RSV as something that I wanted to do for the project. Is because I feel like it's not talked about enough about how it can really affect people, especially small children and then older adults over 65. With them too, it really can be deadly, and it's kind of scary. So let me see, I can get it fitted in the camera a little bit for y'all to see and stick in. Okay, I'm trying to mirror it to my TV, but it didn't work. So RSV. So RSV. So let's see. What is it? It's an upper respiratory infection. That's what it basically is. Oh, I cannot see this. I add the link to it. So, oh Jesus, you can't see me. Okay, so RSV was first discovered in 1956, and the way that it was discovered, it wasn't first discovered by testing it in humans. It was actually first discovered by testing it in chimpanzees who suffered from I guess you would say a common cold, and that's how they discovered it. But eventually, in 1956, a man by Robert M. Chinook ended up finding the same virus in children that was suffering from upper respiratory infections. So the disease can cause inflammation of small air passages that they enter into the lungs. That's what happens. And then it can enter either through the eyes, the nose, the mouth. So the disease, kind of like how COVID-19 was, it is airborne. That's how it's transmitted. So somebody that's affected by it, they're coughing or they kiss you, they hug you, any type of close contact to a person that's affected, those little droplets just releasing in the air, and bam, you can easily get the disease like that. The signs and symptoms, initial symptoms, and something that's minor, is not major or urgent, to call the hospital about the disease. Are they similar to symptoms of a common cold? That's why some people probably wouldn't pay no attention to it, a runny nose, coughing, sneezing, fever, sometimes wheezing, and even a decrease in appetite. Now, symptoms that will require urgent care and even lead to hospitalization is difficult breathing, not getting enough fluids, especially in little kids that are very active. You see they're tired and not really doing anything, their activity has decreased, nasal flaring, and blush lips, and their fingertips also. So, and then also signs and symptoms can vary by age. And I found this little chart that I thought was nice, how they organized it like that. Yeah. So different symptoms in different age groups. Now that the way that they will diagnose this and tell if a person actually has it is through a mouth swab, or they do blood tests to test your white blood counts, a chest x-ray or a CT to see if they can see any of the inflammation that's in the lungs, or like I said, they'll swab your mouth to check signs of the your mouth or nose to check signs of the virus. This is airborne, so you can see like with the swab, it's similar to how they check for COVID. Also, because they'll check your O2 levels with the little thing. Damn, what is it called? Something in my tongue. I use it all the time. But yeah, they'll check it to see if your oxygen decreasing, and also the time of the year and how your medical exams and physical exams and all of that, it plays a role in the diagnostic process to help doctors really feel like what's going on. That really kind of plays a role, like I was saying, in like the small children who were like 2 or under, and then adults that were like 65 or older. Really helps them diagnose it, because majority of the time those are the 2 age groups or where people had to get hospitalized. Now, but the treatment with mild cases, like I was saying, like with cases that have the symptoms that are similar to common colds, it will usually go away, like how a common cold kind of go away. It will usually go away with a week or so without any form of treatment. But like just for like little small things, like for a headache or the fever, like you'll do Tylenol, or like with the runny nose, you can do like a nasal spray, and then you'll make sure you drink like plenty electrolytes to help with the little mild dehydration that you'll have. Just little small stuff with that, like stuff you can do at home, won't have to go to the hospital for, like, and then something you won't have to go to the doctor to get medication for, like any over-the-counter pain reliever or anything to help with your symptoms. Now, severe cases, like I said, they're coming in infants that are 6 months and under, and adults 60 and older. So most of the time, they'll go into the hospital. They have to be put on oxygen. They'll need an IV fluid. They'll also sometimes need a breathing machine. It can also lead to a tube feeding, and if they have like a lot of mucus buildup, they'll have to kind of go in and suction some of that out. Now, for most cases, people don't be in the hospital long, maybe from like a few days and at the most a week. Now, if it's very severe, it'll be longer than that, but that's about it. So ways that like I was saying, like this is similar because it's an airborne disease, also the COVID. So like make sure you're washing your hands for at least 20 seconds. Get you some like disinfectant spray and make sure you're spraying everything. If you're home, stay sick. If you're like sick with it, like don't be giving out hugs, kisses, none of that. Really keep your distance from people. And like if you're coughing, or sneezing, make sure you do the little elbow, and make sure you want to wash your hands after that too. Spray yourself with a little Lysol too. Now, preventions. It's for, like I said, it hugely only affects like infants and young children, and then adults over 60. So therefore, when we're talking about preventative measures, from what I got from the CDC, they're really only for those 2 age groups what they have. So for infants and young children, they have like a antibody that they can give them, and it's recommended for babies 8 months or younger during like this will be like their first season of RSV. Now the RSV season is usually in the winter months, so it's usually from roughly mid-September to like end of January going to February. So in between like them months, like for like the first part of the baby's life, in between that, and then some children they can be increased risk, so they also recommend it for kids between the ages 8 months to 19 months during their second season of RSV. Also, pregnant women can get like a vaccination while they're pregnant between 32 to 36 weeks during the seasonal months, like I was saying, of the virus. So between their mid-September going into January-ish. And then also, they have 2 different vaccines for adults that are 60 and older. And usually they'll just like go and discuss it with their doctor and see if it's the best fit, because also some doctors may recommend it to them also due to like 60 and older, due to any other underlying health conditions that they might have that also might cause them to be at increased risk for the disease, for the virus. And also, our immune system tends to weaken due to age, so that's why it's also good for them. So one thing else I don't think I touched. RSV, like it can start at RSV, but it can lead to pneumonia, and usually in 60 or older, it can also lead to congestive heart failure. And this is my project on RSV. Thank you all for listening. I hope you have a good day. Thank you. Bye.